Hi everyone. I wanted to give you an update. I had my pre-op appointment on December the 10th, which was yesterday, with my surgeon, and then I went over to the hospital and did all my pre-assessment, which included the nurse interviewing me about my medical history and putting my medications in the computer. I got an EKG, lab draw, and a chest x-ray. So I am on schedule for surgery for Tuesday, December the 16th. Those misgivings that I had that I'd spoke about in my previous video of fears of something not going smoothly and my surgery getting canceled again as it had back in September, those have been alleviated with this last appointment. In fact, my surgeon went over my surgical consent and I signed that, and I don't foresee any roadblocks for my surgery going forward on Tuesday. He did tell me that I would not be first on his schedule, that I would probably be second or third, that in the event that my blood sugar was high on the day of surgery, that would give him a patient ahead of me or two that he could give orders to lower my blood sugar with insulin dosing. He said that anesthesiology will sometimes try to cancel a surgery if the blood sugar is too high, but he said that he's dealt with diabetics that have high blood sugars before, and this has always worked, that while he's operating on another patient, that gives them some chances to give me some insulin and lower the blood sugar prior to going into the OR. So I'm really not anticipating my blood sugar being that high. It has been running high lately, I think just due to natural stress and not feeling well and everything. But I know that when I was on the pre-op diet back in September, before that surgery got canceled, my blood sugar did drift down to an acceptable range, and I anticipate that again. I started my pre-op diet today, and it is a much better diet than the last one I was on. I'd mentioned previously I had done the surgeon had a 14-day liquid diet, no solids, and I had done 6 days of that before my surgery got canceled. This surgeon only requires a 5-day pre-op diet, and he gives you very loose guidelines and just says that you can have 2 protein shakes a day and a moderate meal. You know, he said within reason. He said don't go crazy. So, and then of course he gave me a list of all the no-calorie, no sugar added type things that I could have in between, and he did recommend again 5 meals a day, like breakfast, a mid-morning snack, lunch, an afternoon snacks, and then supper and another snack if needed. So he said that way your blood sugar stays a little bit more stable with something in your stomach throughout the day, and he said and you won't have a hunger pain. So I didn't have any problem with that diet I was on previously, and it was much stricter. I didn't find myself getting hungry when I ate frequently, so that's just what I did today. He did tell me that I could have a low-calorie Greek yogurt in the mornings if I wanted, because it's high in protein. So that's what I started out with this morning. I had 100-calorie Greek yogurt, and then at about 10 o'clock I had a flavored non-carbonated drink, and then I had a protein shake at noon. About 2 I had another drink, and of course I've been drinking water in between. I want to try to start getting in the habit of getting my water in. Then about 4 o'clock I had my second protein shake, and at 6 o'clock I had a mixed green salad with grilled chicken, no dressing. So I've done really well today. I'm not hungry. I haven't had the munchies, and that's a big thing with me. When I get nervous or anticipatory, I want to graze, but I haven't. In fact, I went over to my mother's today. Today was her birthday, and spent the day with her, and we did some crafts and sat around and talked and things, so I didn't, have an opportunity to get bored or feel like I needed to raid the refrigerator. I'm pretty confident with my surgeon. I just love him. He was so patient on the pre-op appointment. He has the attitude that you're the only patient that he has, that he doesn't have a waiting room full of other patients. He takes his time. He doesn't make you think that you have to grab his coattail to hold on to him to ask any last questions. And he is very optimistic about my surgery. Incidentally, I saw my gynecologist later that afternoon for my annual appointment, and he was also very excited about my surgery. He told me that he had several patients that had been sleeved with great success, including diabetics, who were able to finally get their blood sugars under control. And I think that's the thing that I'm anticipating the most is if I can ever get this diabetes under control, I will feel like I have made an achievement of my lifetime. I've been battling with diabetes since 2000, and there's a lot of failure associated with not being able to control your blood sugar and a lot of self-blame. That doesn't necessarily apply to what goes into your mouth. So I'll be very excited to see those blood sugars drop. I've already had a drop in the scale. I was 208 at the surgeon's office, which is a 7-pound weight loss from my last visit last month. I wish I could say that it was because I've been careful about what I'm eating, but more than likely it's a result of the diabetes. When your blood sugars run high, you tend to go into a little bit of ketoacidosis anyway and burn off your protein and your muscle rather than fat. So anyway, I anticipate maybe another 5-pound weight loss during these few days at max, and he wasn't concerned about it. He said that because of the low BMI, that he didn't think that my liver would be a problem during the surgery, and he's also excited as well. We set a goal weight for 150 pounds for me to start with. I've never been 150 pounds as an adult. My lowest weight as an adult was in the upper 180s. And my highest weight as an adult has been 238 pounds, but that was pre-lap band almost 10 years ago. I've always hung out in the low 200s, never hit Wonderland as an adult, so I'm looking forward to that as well. We're on track. I'm happy, I'm confident, I'm just ready to get it done. He did tell me that I would be in the hospital overnight, possibly 2 days since I have complications. He said we'd see how I was feeling and go from there. I did go ahead and start Miralax today. When I was on the liquid diet previously, I went 5 days without a bowel movement. I am prone to constipation because of my autoimmune diseases, so we went ahead and resumed my Miralax, and I'm hoping to head that off at the pass. I know a lot of you have stated that you have problems with constipation post-op as your body adjusts to eating less food and not being able to take in enough fluids. So I want to be proactive about that. He did tell me that I would have a drain, Jackson Pratt, which is called nicknamed a JP drain, which is one of those little drains that looks like a small clear football that you compress. He said the reason he uses that if I have a leak, he will know it immediately because fluid will return into that drain, and I will keep that drain until a week post-op. In fact, they told me I'd be returning on Christmas Eve for my post-op appointment where they'll take the drain out, check the incisions, and such as that. So everything's falling into place. I don't know if I'll make another pre-op video for you guys, but I'll definitely check in post-op as soon as I feel like it. And I'm anticipating a smooth surgery and this going well, and starting my life on the way to better health. So I think that if I can get this diabetes under control, that it will be an accomplishment of a lifetime for me, and any weight that comes off with it is just going to be bonus points. So you guys have a blessed day, and I hope you enjoyed watching my video. I hope that you guys will subscribe to my video and follow my journey. I want to be a part of the weight loss community on YouTube, and I look forward to watching some of your videos as well. If you have any one to recommend that's currently vlogging that is new to surgery, please let me know, and I'll check out the videos. Good night.